Hello, this is Catherine Burke doing a video for the bones of the axial skeleton for Bio 235, Ms. Vance's class. We're going to be going over a list provided of structures to go over, and we'll try and zoom in on smaller structures so we can see what we're pointing at. So here's Mr. Bones. It's going to help us with our structures. Again, starting with the axial skeleton, we have our skull, our thoracic cage, and the vertebral column. We're going to start with the bones of the cranium and zoom in on that so we can see a little bit more detail. Okie dokie, that's good. The first bone is our frontal bone, which makes up the interior cranium, posteriorly paired with the parietal bones on the left and the right side. Posterior to that is the occipital bone, which has a small external occipital protrusion, which you can feel with your fingers if you feel the back of your head. There's a few ridges that connect to the vertebra to hold the neck and skull together. On the medial side of the skull, we have our temporal bone, and our temporal bone makes up what we have a temporal mandibular joint. Right in here, the mandibular fossa on the inferior surface of our zygomatic process meets a condylar process of the mandible, right here, forming the temporal mandibular joint, which is freely moving. Next is our mastoid process. It's an anchoring site for some neck muscles. Just inferior to that is a little pointy sharp bone here, called the styloid process. It's the attachment point for several tongue and neck muscles. On the outer surface right here, we have the external acoustic meatus, which is our inner ear. And just superior to that, we have the squamous part of the temporal bone, which meets up with the squamous sutures, which are these black little lines we'll get back to in a moment. Interior view, there's what's called the petrous part of the temporal bone, and what that does is it houses the middle inner ear cavities, and it abuts, again, the squamous sutures. It's right about here. And then internally, we have the internal acoustic meatus, which is the opening to the ear canal, and it passages cranial nerves 7 and 8. You can't really see it, but we can try and point it out here, because we're also going to go to the sphenoid bone. So let's see the angle we can do. Coming up here. Alright, so this is the superior internal view of our skull, and the internal acoustic meatus is a little fossa right in there. Oops, fossa right in there. The sphenoid bone is this pink portion right here. It spans the width of the middle cranial fossa. There is the greater wing and then the lesser wing. Let's see, it has a crescent-shaped row of 4 openings right in here. And the superior orbital fissure is interior most between the greater and lesser wing right here. And it allows cranial nerves 3, 4, and 6 that control eye movement to enter. Again, the interior view here, we have the greater wing and the lesser wing. Moving on we want to point out the optic nerve. It lies interior to what's called the stella turcica, which has the optic nerve for cranial nerve 2 to pass to the eye, right here. And then also we have the stella turcica, which right in here kind of protrudes up. And what that does is it's an enclosure for our pituitary gland. Next we have our ethmoid bone, which lies between our sphenoid and a nasal bone. In its interior view here, we have what's called, you see this little line, it's not very straight, it's called the crista galli, which projects superiorly between these cribiform plates on either side. It's a triangular process and is the attachment site for the meninges that cover the brain, anchoring them into place. Again, the cribiform plates form on either side, and they're punctured by tiny holes that allow filaments of the olfactory nerve to pass smell through the receptors of the nasal. Coming back to the external portion, which will hopefully be a better view for us, we're going to go over the sutures of the cranium. Put his crown back on. So we have a few sutures here of the cranium. The sutures are what hold the skull together by interlocking joints here, which I've outlined in a black marker. The first one is the coronal, and that meets up with the parietal bones and the frontal bone. It's what separates the two. Next we have the sagittal bone, or the sagittal suture, which separates the two parietal bones. And then on the posterior side we have the lambdoid, where the parietal bones meet the occipital bone. Excuse me. And we have the squamous sutures on both sides of the temporal bone. Now we're going to go to the facial bones. See if we still have a good view here. Okay. So our facial bones include 14 bones, and the mandible and the vomer are the only unpaired ones of the facial bones. So we have the maxilla, which is right here, and that houses the alveolar process. These are the upper jaw that carry the teeth. There's little sockets, the alveolar process are little sockets that our teeth embed into. We have our nasal, which is the rectangular bone right here. Then we have the zygomatic bone in blue, and both the zygomatic bone and the temporal process here in orange form what we call the zygomatic arch, which makes up our cheekbones. The ethmoid, again, from an external view here, you see a little bit here in pink, and it's just through the eyes here.